Hey buddies, welcome to my YouTube journey. Stay tuned and be blessed. Hey buddies, welcome back to another video. I hope you guys are good. I hope you guys are safe and blessed abundantly. Thank you guys for the love and support that I've been getting from the previous video. You guys are super amazing and we are growing. Guys, so as you guys know, I am a medical male circumcision surgeon and I have been trained by chaps earlier this year. Shout out to Dr. Ndlovu, Dr. Paul, Sister Zoto from Right to Care. They were so amazing. The training was a very lovely experience and I've learned so many great skills. So therefore today's video is all about circumcision. Well, almost, because I'm only going to share the basics of circumcision so that you guys can understand, and hopefully that you get your male friend, your husband, your boyfriend, every male to go get circumcised. And yeah guys, also for confidentiality purposes, if you don't feel free to like comment below or your questions or something, you're always welcome to DM me on Facebook. Okay, not really DM me on Instagram, and also we can messenger on Facebook, if that's what it's called. So in this video, we're going to talk about what is circumcision, why do you have to do circumcision, who is eligible to get circumcised, and the risk, the benefits, the procedure, and also what to do after the procedure. So yeah guys, let's get right into the video. So circumcision is a permanent surgical removal of the foreskin, which is the fold of the skin that covers the head of the penis. So yeah, that is circumcision. So guys, I'm going to be talking about penis, vagina, all, since this is a medical topic, so we are allowed to speak about anything and everything. So yeah, don't be embarrassed to say that. Done for several reasons to treat medical problems relating foreskin, and practice for traditional and religious practices or reasons, often within the first 2 weeks of the birth, and also at the beginning of adolescence as a rite of passage into adulthood. So where I work, the policy says we need to circumcise males from 10 years upwards, but any male can circumcise, any healthy male. By healthy, I mean if you have high blood pressure, it needs to be controlled. If you are HIV positive, you need to give us a proof of that the viral load is undetected. And also if you are diabetic, your diabetes needs to be controlled. But honestly, from my point of perspective, or according to studies, diabetic people are at risk of getting phones and gangrene. So yeah, I am not really comfortable in circumcising a patient who's diabetic, but we can refer you to a tertiary hospital. So there is also an early infant male circumcision, which is performed on healthy male newborns from 12 to 24 hours after birth, and young infants up to 60 days of age. So benefits of circumcision: it reduces the risk of urinary tract infection in childhood. It also prevents balanitis, which is the inflammation of the foreskin and the head of the penis, and posthitis, which is also an inflammation of the foreskin. It prevents the potential development of scar tissues on the foreskin, because the foreskin will be gone. And also it prevents some STIs, especially the ulcerative diseases like syphilis, which is a bacterial infection that is spread by sexual intercourse, and it causes a painless sore, and also chandroid, which is also a bacterial infection. It reduces the risk of getting infected with HIV up to 60%. So the 40%, guys, is you can still get infected by HIV, so you have to use protective measures. So let me explain how this works. So the foreskin has Langerhans cells which attract the HIV virus. So if you happen to sleep with an infected person, then that is most likely that you can get HIV, because it attracts like those the cells, the Langerhans cells attracts the HIV virus. So yeah, please protect yourself, guys. Is pain, which we do give painkillers for, and it's only pain that you will experience when we inserting the anesthesia. The second one is bleeding. Mostly we do control the bleeding, and hematoma, which is bleeding under the skin. Infection at the size of circumcision, which is also rare because we do give antibiotics, and increased sensitivity of the glands. Adverse events due to the anesthetic used if you are allergic to it. But I must add that data from collected research shows that 1 in 50 complications happen. So really there is complications. So there are 5 procedures used, well, one actually. So it's either we use a device or the surgical method. So the device is a prepegs or a shang ring that we can use, and also the second surgical methods are a dorsal slit, which is what we use, the method that we use, sleeve resection, and forceps guided. We don't use the two, but we use the dorsal slits. Okay, so what happens in our facility is that you're gonna get to the reception area, and you're gonna find the receptionist there. You must have your ID if you're a male older than 18, but if you are 16 and below, have your, if you don't have a ID, get your birth certificate. And also when you are accompanying a child to circumcise, obviously the mother needs to, you need to have an affidavit stating that the mother agrees that you accompanying the child to come get circumcised, and you must have your own ID, the child's birth certificate, and also the mother's birth certificate, or the guardian. And then you're gonna, okay, they're gonna write all the details, and then you're gonna go to counseling, which they will counsel you about what is circumcision and what you must do, you know, like your proper counseling if you are ready. Also there is HIV test available there, but you are free to say that it's not compulsory actually to test. Okay, then you're gonna go to the pre-op assessment, where we will the enrolled nurse will check on how are you physically well, and just check you overall, and also your vital signs. And then if there's anything wrong, we stop and we ask you questions, or we do something else. And then the second one after that, then you're gonna go to the room itself, where we're gonna start the procedure. So then we localize you so that you won't feel any pain. And after localizing, obviously this is all in a sterile field, so everything is clean, everything is safe, and yeah, it is the procedure. And then you really honestly you won't feel the pain, you really won't feel the pain while we are busy cutting and doing everything. And after that we are actually done. You're gonna go to the post-op assessment. Okay, so in the post-op assessment, we ask you firstly if you are not dizzy, telling us that you are not reacting to the anesthesia that we gave you, and we do vital signs immediately. And after that, obviously the penis will be kept straight. That is very important, so that we can avoid bleeding and also swelling. So it must be kept straight for 10 days. And we're gonna tell you, or we tell you actually, to come back for your 2-day and 7-day follow-up. That is very important. Please go, so that we can monitor your progress, and also if we see if is there any side effects or no. Okay, so on day 2, when you go for your follow up, obviously the wound will still be bandaged, right? And the area will be dry if you followed the instructions. So your hands must be clean at all times. When you go to the toilet, clean your hands. Before you go, clean your hands, like your underwear and hands must be clean at all times. So day 2, you're gonna obviously have bought in the green part soap, put it in lukewarm water, soak it off, and then put the wound in the that water. So obviously it will, like, the water will make the bandage to be like to be, what can I say, izotambisa, so that it izophuma, right? And then after that you're gonna take it off, obviously, because the water will make it easier actually to for you to peel the wound off. And then cool, you're gonna go to your facility or nearest clinic. And then on day okay, then yeah, day 7, obviously the penis must still be kept up straight. And now when you wash the wound, you need to dry it properly. That's also very important. Dry it properly. And then yeah, when you feel pains, there is painkillers that we give you, but please don't overdose on the painkillers. Just drink it whenever you feel pain. And also in the morning, it is most likely that you do get erections, so it is better to go to drink a lot of water so that you will urinate a lot more, because it helps with erections. And also, what else did I forget? um yeah, if you experience any bleeding, any side effects that you think like this is not normal, then you can contact your facility or your doctor or whoever. And then yeah, I think that is it from after the procedure. Oh, the most important one, guys, this is so important. No sex, no intercourse until after the 6 weeks. So this is very important, guys, because if you do that within the 6 weeks, you risk yourself of getting infected with HIV. And also the stitches will break apart, so that will lead to infections and also complications. So you don't want that. So please, 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 intercourse is a no goes on. And also I feel like this is very important also to get your partner involved, so in ways of like preventing you to have intercourse in that law. If no, what can I say, like to be tempted to have like intercourse, don't talk about it. Firstly, don't talk about intercourse. And also yeah, when you feel like having intercourse, just do something that you like reading, or I don't know. But also alcohol is a no-go zone. And also reduce your smoking, because you know what happens with alcohol. As a child, I forgot to add that as a child, it's way much better to circumcise when you're younger, because it heals quickly, and you also won't think of intercourse and stuff like that. So yeah, ask your nearest doctor, clinic, any healthcare worker where you can circumcise. But if you're around Pumalanga, please DM me. I'll list all the places where you can go. You should also receive a pamphlet on circumcision, and to read about it and to read more. So yeah, that is all from me. I hope you guys enjoyed this video. I know it was all over the place, but if you want more information, I think you can just go to the chap's website. They will give you all the information. I will link it in the description below. And also, please guys, get your male circumcised. I mean, like, hello, after you've seen the benefits, why don't you want to get circumcised? So yeah, thank you guys so much for watching this video. I hope you like it. Please subscribe and like this video. Comment down below on what you got actually from this video. And till next time, see you guys. Bye, buddies. Okay. So it reduces the risk of penile cancer. It also reduces the risk of cervical cancer in female sexual partners. So ladies, get your male to circumcise. And also it is safe and done by a well-trained healthcare worker. And also it reduces